After the age of 60, blood vessels naturally become less flexible, making it harder for them to expand and contract efficiently. The body's ability to regulate blood pressure also becomes less consistent, and some of the hormones that help protect the cardiovascular system during sleep become less effective. As a result, the heart has much less room for error than it did years earlier. Think of it like driving a car with fewer backup safety systems. During the day, your body has several ways to compensate when something places extra stress on the heart. At night, many of those protective responses become less active, while your body focuses on rest and repair. That's one reason why the early morning hours, especially between midnight and 6 a.m., are associated with a higher risk of heart attacks and strokes in older adults. Although you're asleep, your body is still responding to everything that happened during the evening. The food you ate, the medications you remembered or forgot to take, even the environment in your bedroom, all of these factors influence how hard your heart must work while you sleep. Now let's begin with the first habit, one that surprises many people because it feels completely normal. Let me ask you a simple question. What time did you eat dinner yesterday? And what did you have a lie to bake? When I ask my older patients this question, I often hear similar answers. Many tell me they eat dinner around 8, 9, or even 10 o'clock at night. A generous serving of rice or pasta, meat, perhaps some fried food, followed by relaxing in front of the television before heading to bed an hour or two later. It's an understandable routine. Busy schedules, family commitments, and lifelong habits often push dinner later into the evening. But from a heart health perspective, this pattern deserves much more attention than most people realize. Eating a large, heavy meal shortly before bedtime places significant demands on your cardiovascular system at the very time it should be preparing for rest. Most people picture a heart attack happening in a dramatic way. They imagine crushing chest pain, sudden numbness in the left arm, or someone collapsing without warning. That's the image we've all seen in movies and television. But real life isn't always like that. For many adults over the age of 60, the most dangerous heart attacks happen silently. They develop gradually during the night while a person is fast asleep. There may be no severe pain, no obvious warning signs, and no opportunity to call for help before it's too late. One of the biggest surprises for many of my patients is discovering that these nighttime cardiac emergencies are rarely random. In many cases, they begin with ordinary decisions made just before bedtime, choices that seem completely harmless, but can place unexpected strain on the heart during the hours when the body is most vulnerable. After spending more than 2 decades caring for patients with heart disease, performing complex cardiovascular procedures, and treating countless heart attack survivors, I've noticed one recurring pattern. The same evening routines appear again and again in people who never realized they were increasing their own risk. The encouraging news is that these habits are often preventable. During today's video, we'll explore 5 common nighttime behaviors that can quietly increase the likelihood of a heart attack after the age of 60. More importantly, you'll learn practical changes that can help protect your heart while you sleep. Stay with me until the end, because one simple adjustment to your evening routine could make a meaningful difference to your long-term heart health. Before we discuss those habits, it's important to understand what actually happens inside your body while you're sleeping. Many people assume the heart simply rests at night. In reality, your cardiovascular system continues working around the clock. During healthy sleep, it shifts into what doctors often describe as a recovery mode. Blood pressure naturally drops by roughly 10 to 20%, your heart beats more slowly, and your blood vessels relax. This overnight reset allows your heart and circulation to recover from the demands of the day. However, aging gradually changes this process together. In some cases, breathing pauses for 10 seconds. In others, it may last 30 or even 40 seconds before the body forces itself to breathe again. These interruptions can happen dozens of times every hour without the person ever becoming aware of them. Every pause in breathing causes oxygen levels in the bloodstream to fall. Your brain immediately recognizes this as an emergency. To protect you, it activates the body's fight or flight response. Stress hormones like adrenaline and cortisol are released. Your heart begins beating faster and your blood pressure suddenly rises. Although you're asleep, your cardiovascular system is repeatedly thrown into a state of alarm. Imagine your heart being forced to respond to an emergency not once or twice, but 30, 40, or even 50 times during a single night. Now imagine that pattern repeating night after night, year after year. It's easy to see why this places tremendous strain on the heart. Studies have found that untreated sleep apnea is associated with a much higher risk of heart attack and several other serious cardiovascular conditions. It is also strongly linked to abnormal heart rhythms, particularly atrial fibrillation, which significantly increases the likelihood of stroke. In addition, the repeated surges in blood pressure caused by interrupted breathing may accelerate the damage to blood vessels, making arteries stiffer and less healthy over time. The greatest challenge is that all of this happens while you're asleep. Most people have no idea anything is wrong until a major health problem finally appears. So how can you recognize the warning signs? Loud persistent reversing breathing culture could really heavily pee with the necroperi. Ask whether taking your blood pressure medicine in the evening might be more appropriate for your specific condition. It's a short discussion that could have a meaningful impact on your long-term heart health. Some clinical research has suggested that, for certain patients, taking blood pressure medication at bedtime may improve overnight blood pressure control and reduce cardiovascular risk. However, the best schedule varies from person to person, which is why any changes should always be made under medical guidance. One thing is certain, never assume that medication timing is unimportant. In cardiology, the right treatment at the right time can be just as important as the medication itself. Unfortunately, many older adults have never had this conversation with their doctor. Now, I'd like you to think about someone you know who snores loudly. Perhaps it's your husband or wife. Maybe it's one of your parents. Or maybe it's you. For many families, snoring is treated as nothing more than an inconvenience, a nightly joke, or a reason for someone to nudge their partner awake. But from a heart specialist's perspective, persistent loud snoring deserves much more attention. After decades of caring for patients with cardiovascular disease, I've learned to view it as a possible warning sign until proven otherwise. One of the most common causes is sleep apnea, a condition that often goes unnoticed for years. Sleep apnea is among the most underdiagnosed sleep disorders affecting older adults. Experts estimate that a significant percentage of people over 60 have some form of it, yet many remain completely unaware because the condition occurs while they're asleep. Now let's move to another habit that deserves your full attention, because it is responsible for a surprising amount of preventable heart damage. If you're over the age of 60 and take medication to control high blood pressure, and statistics show that well over half of older adults do, there's something many people overlook. It's not only what medication you take, it's when you take it. This is an important detail that often doesn't receive enough attention. Blood pressure naturally follows a daily cycle. For most healthy people, it rises after waking, reaches its highest point during the day, and gradually falls while they sleep. However, this healthy nighttime drop doesn't happen for everyone. Many older adults, particularly those living with hypertension, continue to have elevated blood pressure throughout the night. Some even experience a significant rise during the early morning hours when they're asleep. Doctors refer to this condition as nocturnal hypertension. Although many people have never heard the term, it can quietly increase the risk of serious cardiovascular complications. Why? Because your arteries are especially vulnerable during sleep. A sudden increase in blood pressure at 3 o'clock in the morning can place enormous stress on weakened blood vessels. It may cause unstable plaque inside an artery to rupture, leading to the formation of a blood clot that blocks blood flow to the heart. This is one of the reasons many heart attacks occur during the night or in the early hours of the morning. Now consider this. If your blood pressure medication is taken only in the morning, its effect may have weakened by the time your body enters these high-risk nighttime hours. And if you occasionally forget to take it, your cardiovascular system may be left without adequate protection when it needs it most. So what should you do? Have a conversation with your healthcare provider about the timing of your medication. Here's why digesting a large meal requires a substantial increase in blood flow to the stomach and intestines. To meet that demand, your heart must pump harder, circulation increases, and blood pressure may temporarily rise. At the same time, levels of triglycerides, the fats that circulate in your bloodstream after eating, begin to increase, usually reaching their highest point within 2 to 4 hours following the meal. Now imagine going to bed while all of this is happening. Instead of entering a calm recovery state, your cardiovascular system is still working overtime to support digestion. Rather than allowing your heart to slow down and recover, you've unintentionally asked it to handle two demanding jobs at once. Maintaining healthy circulation during sleep while processing a large evening meal for an older heart that may already be coping with stiffened arteries or underlying cardiovascular disease, that additional workload can become far more significant than most people realize. As your body prepares for its nightly recovery process, a heavy digestive workload forces your heart to keep working instead of slowing down. These two processes compete with each other, and for adults over 60, especially those whose arteries have become less flexible with age, that extra strain can become a serious concern. Research has repeatedly shown that eating a large meal within 2 to 3 hours of bedtime can increase nighttime blood pressure. It may also raise the likelihood of acid reflux, which can sometimes imitate heart attack symptoms or even place additional stress on the heart. Over time, this combination may increase the risk of cardiovascular problems during sleep. Fortunately, the solution is simple. Whenever possible, try to finish your evening meal by around 6 or 7 p.m. This gives your body enough time to digest before sleep. If circumstances require a later dinner, choose something lighter. Lean protein, vegetables, and smaller portions are much easier on your cardiovascular system than heavy, fried, or high-fat meals. Think about your own routine for a moment. Does this sound familiar? Many people answer yes, without ever realizing that something as ordinary as dinner timing could influence their heart health. But after the age of 60, when arteries may already be narrowed or less flexible because of aging or plaque buildup, Maintaining good circulation becomes much more important. Another factor to consider is what happens during sleep. As you rest, your heart naturally beats more slowly, and overall circulation becomes less active than it is during the day. If your body is also dehydrated, your cardiovascular system may have to work harder to maintain efficient blood flow during these overnight hours. While dehydration alone doesn't automatically cause a heart attack, staying adequately hydrated is an important part of supporting healthy circulation and overall heart function. That's why finding the right balance is essential. Rather than avoiding fluids altogether, aim to stay well hydrated throughout the day and avoid drinking large amounts all at once right before bedtime. This approach can help support both heart health and more comfortable sleep. When you combine mild dehydration with slower nighttime circulation, many hours of lying still, and arteries that may already be narrowed by age or plaque buildup, you create conditions that can place additional stress on the cardiovascular system. This helps explain why many heart attacks and strokes occur during the early morning hours when the body is still asleep and most people least expect them. The good news is that one simple habit may help support healthy circulation. Before going to bed, drink a moderate glass of water around 8 ounces or about 240 milliliters. There's no need to drink excessive amounts. The goal is simply to stay adequately hydrated without disrupting your sleep. It's also a good idea to keep a glass or bottle of water beside your bed. If you wake during the night feeling thirsty, take a few small sips instead of ignoring it. Your body may be signaling that it needs more fluids. Protecting your heart doesn't mean sacrificing a restful night's sleep. With a little planning, you can support both. Now let's talk about another bedtime habit that surprises almost everyone because it seems unrelated to heart health. Think about your bedroom for a moment, not your mattress. For my patients over 60, especially those with high blood pressure, heart disease, or a previous stroke, I consider evaluating for sleep apnea an important part of protecting long-term heart health. If sleep apnea is diagnosed, one of the most effective treatments is CPAP therapy. While wearing a CPAP mask each night may take some time to get used to, research has shown that consistent use can improve nighttime breathing, help lower blood pressure in many patients, reduce episodes of certain abnormal heart rhythms, and support overall cardiovascular health. Sometimes one simple habit can make a meaningful difference. So ask yourself this: has anyone ever told you that you snore loudly? Has a family member noticed that you seem to stop breathing while you're asleep? If the answer is yes, don't dismiss it as just another part of getting older. It may be your body's way of asking for help. Now let's look at another bedtime habit that seems perfectly reasonable on the surface, but can quietly create problems for your heart. And many adults over 60 intentionally avoid drinking water during the evening. The reason is understandable. No one enjoys waking up at 2 or 3 in the morning to use the bathroom. Interrupted sleep is frustrating, and getting out of bed repeatedly also increases the risk of falls. To avoid this, some people stop drinking fluids after dinner or even earlier in the afternoon. Although the intention makes sense, this habit can sometimes have unintended consequences. Going to bed, even mildly dehydrated, may place additional stress on the cardiovascular system. When your body doesn't have enough fluid, the liquid portion of your blood decreases, making the blood more concentrated. This can increase the workload on the heart because blood may not flow through the circulation as efficiently. For a younger person with healthy blood vessels, the body can usually adapt without much difficulty. The temperature? Most people choose a bedroom temperature based only on comfort, but your cardiovascular system also responds to the environment around you. If the room is much warmer or colder than ideal, your heart may have to work harder throughout the night. Let's begin with an overheated bedroom. When the room becomes too warm, your body works continuously to cool itself down. Blood vessels near the skin widen to release heat. Your heart may beat faster, and you lose more fluids through sweating. That fluid loss can contribute to dehydration, which, as we discussed earlier, may place additional demands on your circulation. Warm temperatures can also interfere with sleep quality. Instead of spending enough time in deep, restorative sleep, the stage when your body performs much of its overnight recovery, you may wake more often or sleep more lightly. Now consider the opposite situation. If the room is excessively cold, your body responds by narrowing blood vessels to conserve heat. This process, called vasoconstriction, can increase blood pressure because the heart has to push blood through tighter vessels. For someone with high blood pressure or existing coronary artery disease, that extra workload may not be ideal. So what temperature is best?
Within this range, most people sleep comfortably while allowing the body to regulate temperature efficiently. The heart doesn't have to work as hard to cool or warm the body, helping create conditions that support healthy, restorative sleep. Sometimes something as simple as adjusting the thermostat can improve both sleep quality and overall well-being. Now, after hearing all of these habits, you might feel like there are too many things to remember, but I want you to think about them in a different way.
This is also the perfect time to disconnect from screens. The bright light from smartphones, tablets, and televisions can interfere with your body's natural production of melatonin, the hormone that helps regulate sleep. When melatonin levels are suppressed, your brain stays alert longer, making it more difficult for your body to enter the deep, restorative sleep your heart depends on. As bedtime approaches, take a few minutes to prepare your sleeping environment. Lower the room temperature if needed, crack open a window for fresh air when the weather allows, and place a glass of water beside your bed. These are small tasks that take less than 2 minutes, but together they create an environment that supports better sleep and healthier cardiovascular function. Try to be in bed at a consistent time each night, around 10 p.m., is a reasonable goal for many people, allowing your body to settle into a regular sleep rhythm. There's one more simple adjustment that's often overlooked. If you snore heavily or someone has told you that you occasionally stop breathing during sleep, try sleeping on your side rather than flat on your back. For many people, lying on the back allows the tongue and soft tissues in the throat to partially block the airway, making snoring and sleep apnea worse. Side sleeping can help keep the airway more open and may reduce breathing interruptions. While it isn't a substitute for medical evaluation or treatment, it can be a helpful step while you're waiting to speak with your healthcare provider. Now let's put everything together. A balanced dinner early in the evening, proper hydration, taking your medications exactly as prescribed, a relaxing screen-free wind down before bed. Before the tink, some water, the home Instead of seeing 5 separate recommendations, think of them as one simple evening routine designed to support your heart. I like to call it a heart-friendly nighttime routine. It doesn't require expensive equipment or dramatic lifestyle changes. It simply involves making a few thoughtful choices each evening. Start with dinner. Whenever possible, eat your main meal between 6 and 7 o'clock. Choose a balanced plate that includes lean protein, plenty of vegetables, and moderate portions of healthy carbohydrates. Avoid eating a large, heavy meal right before bed whenever you can. This gives your digestive system time to finish much of its work before your body shifts into nighttime recovery mode. Later in the evening, pay attention to hydration and your medications. Drink enough water throughout the day and consider having a moderate glass before bedtime if it fits your healthcare provider's advice. If you take medication for high blood pressure and have never discussed the best time to take it, bring the topic up during your next medical appointment. For some people, evening dosing may be appropriate, while for others, morning dosing remains the better choice. The right schedule depends on your individual health, so it's important to follow your doctor's recommendation. As bedtime approaches, allow your body to gradually slow down. Rather than spending the final hour of the day under stress, give yourself time to unwind. Take a relaxed walk around the neighborhood. Before we finish, I'd like to leave you with one important reminder. Everything discussed in this video is intended for general educational purposes and is based on current medical understanding of cardiovascular health. It should never replace personalized advice from your own healthcare provider. If you're considering changing your medications, adjusting the timing of your blood pressure treatment, or making significant changes to your health routine, please consult your physician first. They know your medical history and can recommend what's safest for you. Thank you for spending these moments with me. Take good care of yourself. Sleep peacefully, and remember, the healthiest tomorrow often begins with the choices you make tonight. So won't wait for next month. Don't wait until your next birthday. Start tonight. Let's review the 5 key steps one final time. First, try to finish your main evening meal by around 6 or 7 o'clock whenever possible, giving your body plenty of time to digest before bedtime. Second, if you take medication for high blood pressure, ask your doctor whether your current dosing schedule is the best option for your situation. Never change the timing on your own, but don't hesitate to ask the question. Third, if you snore loudly, wake feeling exhausted, or someone has noticed pauses in your breathing during sleep, speak with your healthcare provider about whether testing for sleep apnea is appropriate. Fourth, stay well hydrated throughout the day, and unless your doctor has advised you to restrict fluids, consider having a moderate glass of water before bedtime. Keep your bedroom cool and comfortable, ideally within the recommended temperature range for healthy sleep. These aren't complicated changes. They're practical habits that fit into everyday life and may help support your long-term heart health. Now, I'd love to hear from you. Which of these habits do you think is most relevant to your own evening routine? Share your thoughts in the comments below. Your experience might encourage someone else to make a positive change. And if you found this information useful, consider sharing this video with a family member or friend, especially someone over the age of 60. Sometimes one conversation can inspire healthier choices that last a lifetime. Remember, your heart has been working tirelessly every second of every day since the day you were born. It deserves the care and attention that will help it continue serving you for many years to come. This is also the perfect time to disconnect from screens. The bright light from smartphones, tablets, and televisions can interfere with your body's natural production of melatonin, the hormone that helps regulate sleep. When melatonin levels are suppressed, your brain stays alert longer, making it more difficult for your body to enter the deep, restorative sleep your heart depends on. As bedtime approaches, take a few minutes to prepare your sleeping environment. Lower the room temperature if needed, crack open a window for fresh air when the weather allows, and place a glass of water beside your bed. These are small tasks that take less than 2 minutes, but together they create an environment that supports better sleep and healthier cardiovascular function. Try to be in bed at a consistent time each night, around 10 p.m., is a reasonable goal for many people, allowing your body to settle into a regular sleep rhythm. There's one more simple adjustment that's often overlooked. If you snore heavily or someone has told you that you occasionally stop breathing during sleep, try sleeping on your side rather than flat on your back. For many people, lying on the back allows the tongue and soft tissues in the throat to partially block the airway, making snoring and sleep apnea worse. Side sleeping can help keep the airway more open and may reduce breathing interruptions. While it isn't a substitute for medical evaluation or treatment, it can be a helpful step while you're waiting to speak with your healthcare provider. Now let's put everything together. A balanced dinner early in the evening, proper hydration, taking your medications exactly as prescribed, a relaxing screen-free wind down before bed. Before the hot pink, some water, the home catcher won't be at a sun tower. The Andrew Adas.